Namaskar. Thank you for joining. So today we're going to dive in deep and study chronic inflammation and its role in lifestyle disorders. Earlier, I discussed with you insulin resistance, and this is really just as important. And insulin resistant and chronic inflammation are actually intertwined. So they feed into each other, and that is how they result in causing the lifestyle disorders. For example, if you look at blockages, heart attack, coronary disease, in that atherosclerosis, the plaque that builds up in the arteries, chronic inflammation plays a great role. Same thing in diabetes and same thing in obesity. So before I go further, let me just tell you something how there's a strange mechanism in our body. How a physiology becomes a pathology. How a good thing becomes a bad thing. Okay. And that applies to several mechanisms in the body, but more so to chronic inflammation. So inflammation is good, but today you will learn that too much of good thing sometimes becomes a bad thing. It's like, let's take an example, okay? You have somebody rings you up, an old friend, a relative, somebody you grew up with, but somehow lost contact, but you spend a lot of good times together in life. And he says, I'm coming to visit you. See the excitement, pleasure. You meet him, you greet him, you sit down, you talk. It's just wonderful time. You have wonderful time. Time passes, and you say, "Oh, what a great thing you came. I'm so happy. It's so good to see you," and all that, on and on and on. Now, 1 day has passed, and 2 days have passed. 3 days passed. This man is not talking about going away. Now you see how that same pleasure goes into a suspicion. How do I ask him when is he going to leave? And then it's 1 week, and it's 2 weeks as he's not leaving. And now the same person who was so pleasant to you, so nice to you, you're having such a good time, is now your enemy. That's exactly what inflammation does in the body. If it comes somewhere where it's needed, does its role, helps you, and walks away. If it stays for too long, it ends up eating your own body. And that is chronic inflammation as opposed to acute inflammation. Same way, your friend coming in, staying 2 days is acute inflammation. Good, you like it. Your friend not going after 2 weeks or 3 weeks, he stay put at your home, atithi kab jaoge, then that is chronic inflammation. Every cell of your body goes through these three things. Constantly, body cells are being injured and they repair. The reparative process is actually inflammation. Inflammation in its acute form causes repair in the cell. And inflammation in the chronic form causes damage in the cell. So let us see how this happens, okay? So now, you remember that? Acute inflammation, good friend. Chronic inflammation, same friend, not going away, and now it's become an enemy. So that's how it operates. So when you get an inflammation somewhere, God has created in the body 5 responses. Let's say you injure this finger, right? So what happens? You can't move it. That's called loss of function. That's one sign of inflammation. Second sign is there's pain in this, and that's another sign. So that's how God created this inflammation, that if there is injury, don't touch it. It's painful. It becomes hot. If you touch it, its temperature is higher. It becomes red, inflamed. You see the redness, right, when there is injury, and it becomes swollen. It becomes big. So pain, heat, redness, swelling, loss of function. These are 5 mechanisms that are created in acute inflammation, and they help repair. How? Let's say if the function was not lost and you keep using this finger, it's not going to heal. So body created a mechanism that you're not able to move this finger because of pain or swelling or redness, and then you give it rest, and you give it rest, and this finger heals. So this acute inflammation is your friend, right? You got an injury and you cannot use it. You give it rest, it repairs. So something like this, so you get this infection in the finger, it comes immediately, quickly, and you take some medicines or you apply something, take rest, and it goes away and subsides and it's gone. Chronic inflammation is same thing happens like inside your artery, but lingers on for months and months and months and never goes away. Now it is causing damage. Now it is too much of the good thing, which has become a bad thing. So let's again take an example. See, let's say you have an injury and you break a bone right there. See, this is broken. What does the doctor do? He sets it right. He aligns. It's called alignment. He aligns the two bones and he puts a splint or a plaster. That's all he does. Rest, everything is done by the body. So what he has done is, first of all, by aligning, he made sure that it's in line and it repairs. And then the inflammation in the body is healing this. What he has done is he has put a splint or a plaster so that it becomes immobile. You don't use it. So there is no friction, nothing. And then the two stay together, and after 6 weeks, they're healed. And the doctor takes a plaster off. That's all he does in your broken bone. That's how almost all the broken bones heal. And that is the beauty of inflammations. Acute inflammation, in 4 to 6 weeks, your bone is healed. So injury, inflammation, healing, repair, recovery. Good friend, right? So what if there was a repeated injury? You did not apply the plaster and the arm is moving. The two are not connected. So inflammation will persist. It'll keep trying to heal it and heal it and heal it and heal it. The inflammation is going to go overboard. And there'll be poor healing or recovery, and there'll be organ damage. And that is how chronic inflammation. Too much of the same thing for too long becomes a bad thing. Let's say somebody is eating too much sugar and too much fat, and this is how his liver was. Fine, okay? Now, what is the repeated injury? You're injuring the liver with fats and sugar, fats and sugar, fats and sugar. And every time a liver has to work overtime to dispose of extra fat, dispose of extra sugar, dispose of extra fat, dispose of extra sugar. Persistent injury, persistent inflammation, poor healing. It's about to recover, and then you put in more fat and more sugar next day. Then it takes care of it. It's tired, about to rest, and then you put more fat and sugar in it. And the liver gets damaged. And then you call it fatty liver. And then you go to doctors, get all scanned and God knows what, medicine, this, that. Why? How did it happen? You had more fat than you needed, and you had more sugar than you needed. That's what you got fatty liver. So the moment you get fatty liver, don't go to a liver doctor. Talk to yourself. Oh, I'm sorry. Apologize to your liver and say, from tomorrow, I'm going to not put this extra fat and extra sugar. I'm going to give you rest. You're going to heal, and the fatty liver is going to recover. So what is chronic inflammation in our definition then? Low-grade, persistent immune activation, constantly going on, months to a year. And when it is happening at that time, you may have no symptoms. All those patients that develop fatty liver, until the scan shows fatty liver, they don't even know they have fatty liver. Same way, 50% of the young people that get a heart attack, until they get a heart attack, they do not know that they had a blockage that was going on because of inflammation and extra cholesterol and endothelial dysfunction. And that is the irony. Because if there was hurt or pain, you could have taken some action, right? And that is the unfortunate fact of heart attacks. 50% heart attack in India occur in people less than 50 years of age. And in them, most of the time, heart attack is the first sign of heart disease. Until the heart attack happens, they're perfectly fine. No chest pain, no shortness of breath. And 50% deaths from heart attack that occur in India occur in people less than 50 years of age. And that is why I keep saying, say no to heart attack amongst young people. And this is a treatable cause. Chronic inflammation is treatable. Endothelial dysfunction is treatable. And lipid deposition in the arteries is treatable. The three main drivers of blockages in the arteries. You can reverse them. Take the cholesterol out. Take the inflammation away. Lead a healthy life that will tell you that improves endothelial function. The blood vessels start healing. Your risk of heart attack goes down. Okay, so, but there are some early signs, okay? There are some early signs. There are so many patients that come to me and they just feel tired. Sir, do give me some vitamins, sir. Give me some tonic. I'm fatigued all the time. That is the first sign that there is chronic inflammation going on in the body. You know why? You remember when you have a fever, malaria, typhoid, high-grade fever. That's acute inflammation in the body. And see how tired and listless you feel? Same way, chronic inflammation causes chronic fatigue. Not as bad as in malaria or typhoid, but you feel tired all the time. Brain fog, start forgetting things. Some actually can have low-grade fever from chronic inflammation. Your mood, you don't just feel good. You don't feel like talking to people. Life doesn't seem happy. Gut disturbances. A lot of people that come to me, sir, I have gas, I have constipation, I have bloating, I have distension. All signs of low-grade inflammation in the liver, pancreas, gallbladder, and intestine. So if you are having bloating, if you need to take Pento D or Velos D, if you're having acid indigestion, abdominal pain, distension, constipation, you have developed inflammation in the body. There are some markers. So some of you know we check HSCRP on our panel, high sensitivity C-reactive protein. That's one. IL-6 is another one, but it's very expensive, so we don't measure it. So in our 15 labs for the Integrated Heart Center, we always check HSCRP, and we know how much is the chronic inflammation in your body. If you look up there, it says less than 2 is normal, less than 1 is ideal. We aim for less than 1, and more than 2 means there is inflammation. So there are also some subtle signs other than fatigue. There'll be joint pains, muscle aches. A lot of people come to me with this constellation is so common these days. Patients come to me, they're all non-specific symptom. Sir, my joints hurt. I'm tired. I have muscle aches. I have headache. I don't know why I'm gaining weight. I don't eat much. Sometimes I get constipated. Sometimes I get diarrhea. I develop rashes on skin. This tells you that you're developing chronic inflammation in the body. Your lifestyle is pro-inflammatory. What do you need to do? You go to pro-healing lifestyle. And all these will one after the other, one after the other, one after the other, improve themselves. All right. Now, it's so interesting. I see patients here. They come to see me for heart and they say, well, I think it's L-troxin, but I go to an endocrinologist. I say, okay. I have this allergy asthma. I go to pulmonologist. He takes care of that, sir. I see a gastroenterologist for my fatty liver. I see an endocrinologist for my diabetes, sir. I also see a kidney doctor, a nephrologist, because my creatinine is high, my uric acid is high. I have this eczema and psoriasis skin lesion. I see a dermatologist, sir. And I also see an autoimmune doctor for my lupus and this and this. What are they? They're all the end result of chronic inflammation. Okay. In science, in Latin, there is a suffix called itis, itis. So when we say you go to a doctor and he says thyroiditis, that means the thyroid has become inflamed. Itis means inflammation. So then he says, oh, you have cholecystitis. Well, what is it? inflammation of the gallbladder is cholecystitis. Nephritis, you go to a nephrologist. Nephron means kidney, itis means inflammation. Arthritis, arthros, joint, itis, inflammation. Hepatitis, hepar is liver, itis, inflammation. So you're going to all these specialists, 7, 8, 9, for different things, different medicines, not knowing root cause, mool karan of all these itises is chronic inflammation in the body. So if you take care of the chronic inflammation of the body, one by one, you take off your endocrinologist, pulmonologist, gastroenterologist, nephrologist, dermatologist, etc., 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 and cardiologist, and Dr. Sushil Sharma, right? Take care of the chronic inflammation. This is, understand this, know the root cause and know the root treatment for the root cause. So all these lifestyle disorders, atherosclerosis, blockages in the artery, endothelial injury occurs because of inflammation and the plaque forms. Type 2 diabetes, insulin resistance. Remember, insulin resistance causes chronic inflammation. Chronic inflammation causes insulin resistance. They are both coexisting, hurting each other, and making the body pay the price. Obesity. Once you've had this extra body fat, visceral fat, it starts producing certain hormones that then multiplies your obesity. So if you have to lose weight, get rid of the obesity, what do? Tame the inflammation. If the inflammation goes in the mind, Alzheimer's, dementia. If the inflammation releases certain chemical substances called cytokines, you get depression. And if inflammation releases certain procancerous substances that cause cell proliferation and angiogenesis, you get cancer. All coming from the same inflammation. So the trigger could be anything. We'll talk about lifestyle, toxins. What happens? The immune system gets activated. Now all the cytokines, the chemical substances produced by the cells, TNF alpha, IL-6, it's released in the body. And they go everywhere and start causing inflammation in the gallbladder, inflammation in the liver, inflammation in the pancreas. So it's all inflammation. Somehow somebody gets it in the gallbladder more and he presents with gallstones. Somebody gets in the liver and he becomes fatty liver. Somebody gets in the pancreas, he becomes diabetic. Somebody gets in the thyroid, he becomes thyroid patient. Somebody gets in the heart, he gets a heart attack. But it's the same root cause, same root cause. So how do you take care of it? Well, the mother of all anti-inflammatory medicines is food. Nutraceuticals. Nutraceuticals are better than pharmaceuticals. Nutrition as food. All nutrition has those two beautiful things I keep talking about. Remember from my module 3, module 4, module 5, phytochemicals and fibers. Two of the greatest medicines made by plants for our health. Plants are our best friends. Plants heal inflammation. So if this is what you're eating, look at that colorful grapes, beautiful, rich red tomatoes in a salad, apple, right? Guava, strawberries, plums, apricots, kale, bananas, green leafy vegetables, green and colorful. I call it green and rangeen. That's a way to remember. And the more you eat them, closer to their natural status, such as raw. Fruits, 2 fruits a day, 2 vegetables a day, green leafy vegetables, minimally processed, minimally cooked, and then 2 portions salad a day that we recommend. That's enough. So you got the whole capsule. Now, with 2 katoris of green leafy vegetables cooked as little as possible, 2 bowls of salad, one with the lunch, one with the dinner, a plate full of fruits in the morning, right? 5 best medicines for chronic inflammation. 5 medicines, friends, you're giving yourself every day. It's so nice to eat. I love eating fruits. I love eating salad. I love green leafy vegetables. They're so tasty because I know what they do in the body. Remember, I told you three things that you must always do. One is always remember your 14 modules. Number two, remember 10 principles of lifestyle, dash lifestyle. And number three, 10 dietary principles of integrated heart center. Four, to maximize fresh fruits, vegetables, whole grains, and legumes. Three, to minimize sugar, oil, salt. And three, to avoid animal, dairy, and process. There you go. You're already on the process of healing chronic inflammation. You don't need to take any medicine. You don't need to take L-Troxin. L-Troxin is not going to heal your thyroid. It's just going to keep the numbers right. Numbers look good. You feel good. Doctor feels good. Lab person feels good. Pharmaceutical feels good. You paid 500 rupees for consult. You paid 500 rupees for medicine, 500 rupees for test. You feel good. Pharmaceutical got 500 rupees for the medicines, feels good. The lab got 500 rupees for medicine, lab feels good. Doctor got 500 rupees for just writing that thyroxine, he feels good. Everybody's happy. But the thyroid problem is there. So now you got it. These four things, fresh fruits, colorful fruits, legumes, black beans, kidney beans, red beans, lima beans, black beans, peas, kidney beans, all these beans and all Indian lentils, all dal, beautiful legumes full of protein and full of phytochemicals and full of fibers. Green leafy vegetables, colorful vegetables, the richer the vegetable in color, more useful it is. And the more it looks same color on your plate after cooking, more healthy it is. And whole grains, whole grain bread, whole grain rice. And these are the things you need to avoid. All white, white rice, white flour, white sugar, white salt, white butter, white dairy. These are all increasing the inflammation in the body. So four, good. Six, not so good. Minimize. And then spices. I keep saying somehow when I tell people not to put too much oil, not to put too much salt, they also stop putting spice. No. Minimize oil, minimize salt, maximize spice. Now, these spices, the Indian spices, the ginger, the clove, the red chilies, the black cumin, the black pepper, cardamoms, green, cardamoms, black, and cinnamon, and these curry leaves, beautiful. They are the nature's best anti-inflammatory. And look at this turmeric. And if you eat it raw turmeric is so tasty. It's very tasty. Try and do that. The best thing is you cut the raw turmeric and put it in vinegar. And then you eat that with your food. This is a beautiful substitute for achar, pickles. A lot of people eat pickles, which is full of salt, which is full of oil. Two bad things. Whereas turmeric in vinegar and sliced with the dinner. I had it last night in somebody's house. I was so pleased. It exactly gives you the same tangy taste as a pickle, and it's a nutraceutical. The strongest healing capacity of all spices in the body is in turmeric. So remember these spices, maximize them in your diet. I eat two green chilies every day. Capsaicin in chilies is a very good anti-inflammatory. It's not just the body. You also have to keep the mind uninflamed. Remember how that friend that came to your house and overstayed and the mind got inflamed? You have to create a positive psychological well-being. I use the acronym HOPE. HOPE stands for H for happiness, O for optimism, P for purpose, E for emotional vitality. So emotional vitality is the resilience. We are all going to go through phases in life where something happens that should not have happened. And it leaves us very unhappy and injured. We cry. We all experience that in life. We have all cried in life, right? We all have. But emotional vitality, resilience is that, okay, it happened. It's past. It's gone. Let me put things together and get back to life again. So the sooner you come back to your original state of being, after a trauma or an injury, the healthier you are, and that capacity in scientific terms is called resilience or emotional vitality. Purpose. Always have a purpose in life. We are here on this earth not to just enjoy, procreate, pass our time. There's a purpose in life. We came here to do something. And that something, the higher the purpose, more positive psychology you feel in your mind. And the purpose is beyond me. How can I make a difference in the lives of others? How can I make others live longer, happier, healthier? Get rid of the disease, get rid of the blockages, get rid of the fatty liver, get rid of all these problems. And that purpose inspires you. It inspires you. And that's a beautiful way of saying positive in your mind. And that is very good for reducing inflammation in your body. So have a purpose in life which is beyond I and is you. What can I do for you? And amplify that and see how that makes you feel positive and heals inflammation. Optimism. Yes, this happened, but there are better days ahead. Single most important thing that keeps you motivated in life is optimism. Yes, this happened. I know I suffered. It should not have happened. It was unfair. It was unjust. But there are better days ahead. And that is what makes you happy. So to get to this kind of mindset, now it's easier said. Until now, all of this that I said was a beautiful theory, right? It sounded very nice to listen to, very, very sermon-like, right? But I don't believe in sermons. I believe in action. So how do you bring this in your life? You bring it this way. If you're doing these 9 things that I gave you in our modules, prayer, gratitude, forgiveness in the morning, yoga, pranayama, meditation in the morning, and sometime during the day or on the weekend, doing volunteering, connecting, and belonging. 9 beautiful medicines for positive psychology. 9 beautiful medicines for lowering inflammation. 9 beautiful medicines for giving you that happiness, optimism, purpose in life, and emotional vitality. All 4 that I discussed with you come through these 9 practices. Now, when you do this practice, it's not something that you can measure. It's not a blood test. It's not a lab test that you practice this and then you see how the optimism goes from 2.9 to 3.6. You can't do that. It's something that happens in a subtle way from within. It's it's all internal. It's from within. And after a month, 2 months, 3 months, 6 months, 1 year, you notice this. You notice this in your behavior. You notice this. And you know who notices it more when you're practicing these 9 practices and your positive psychology changes? People around you. You find you're more likable. People want to talk to you. They want to come and sit with you. They seek your company. They find you pleasurable. They find you inviting, right? And you also feel good inside. This is a very simple test you can do. I keep saying sometimes, you want to know how boring you are, right? Have you ever done that test to know how boring you are? I'll tell you, very simple test. Okay. I want you to do that, please. I do that sometime. Sometime you decide that I'm going to spend today with no phone call, no WhatsApp, no family member, no friends, no work. Here I am. I took my shower. I come and sit in my living room. I'm just going to sit here. And I'm going to sit with myself. Sushil Sharma today is going to sit with Sushil Sharma. And I'll do whatever I do, my yoga, meditation, pranayama, that all is done. Now I'm doing nothing. I'm just sitting with myself. Sushil Sharma, sitting with Sushil Sharma, not doing anything. And see how long it lasts. If after 1 or 2 minutes you get the itching to open your cell phone, or you look at your WhatsApp, or let me do something, let me get up, let me itch, let me move, let me go outside, let me eat something, right? All these things come. The duration from the time that you decided that you'll sit with yourself to the time where any of these things compel you to stop sitting with yourself, that is the only duration that you are really an interesting person. Yourself is finding difficult to spend time with yourself. Yourself is finding difficulty in spending time with yourself. How do you anticipate that somebody else will like your company? He might also find you, take it, chalo, move on. All right, fine, goodbye. So that is what tells you how interesting you are. If you can sit with yourself and like your company, if you love yourself, you are a lovable, likable person. Others will love and like you too. So that's why I keep saying, before you try to love somebody, love yourself. Okay, so what is the best treatment for chronic inflammation? I keep coming back to the same 10 pillars. Diet, as we discussed, activity, stress, sleep, social, spiritual, harmful exposures, tobacco, alcohol, pollution, adulteration. I keep saying this again and again. You make a copy of this and paste it on your refrigerator. Same way, copy of IHC 10 dietary principles, 4 to maximize, 3 to minimize, 3 to avoid. Make a copy on a refrigerator. And the third thing is coming next. So what's the methodology? What is it that keeps you on track? Keep following 10 pillars. And that is this. Plan to power 8 keys to dash success. So hang dash flyer on your fridge. Hang 10 dietary principles on your fridge. Join the dash community. Join daily yoga, bi-weekly session that you're joining. Study deeply 14 modules. I know that you studied them, right? Again and again, every time you study that, every time you learn something new. And do you know that every 2 to 3 months, I keep some additions and deletions from these modules. I also study them from time to time and I say, oh, this is it. Let me change this to this. This looks better. This way people will understand it better. So I keep editing it also. Same way, every time you read it, you will pick up something new in it. I know you know that you've done the 14 modules, you know, all 102 practices that I mentioned in 14 modules, but sometimes you don't remember them that much. And you may remember them, but they're maybe in the back of your mind, not in the front. So read them from time to time. Commit to daily meditation in solitude, right? And when you sit in solitude, reflect and reinforce your unwavering belief in Dash lifestyle. And always tell yourself, I will follow the Dash lifestyle. I'm not going to look for shortcuts. There is no pill that's going to make you lose weight. If it is, there's going to be a consequence. Nowadays, these beautiful pills have come, like Ozempic and all these GLP-1 inhibitors. And GLP-1 inhibitor right now is almost touted in the West as, well, remember when the Asuras and the Devas did the Manthan and that Amrit came out? They think it's the Amrit. Now, God knows, almost 10% of America right now is on Ozempic, right? We don't know that. They just started. Now, first thing has already come out. And that has come out is people that take these pills to lose weight, like Ozempic. Ozempic has already told them that if you stop this, you cannot stop it now. So once you start taking these pills, how long are you going to take it? 1 year, 2 years, 5 years, 10 years? You can never stop. If you stop, you go back to the same weight, plus you add on 5% more. Now, people don't know it before going on it. Now, somebody is telling me from California, you know, California is the world's capital of plastic surgery. So he was telling me that there's something in California now called Ozempic face. So somehow it makes you lose fat way more on your face in a certain way, the way your eyes sag and your cheeks sag and everything sags in a way that immediately they can say, oh, this is Ozempic face, and then you need plastic surgery. So it's a beautiful business for plastic surgeons now in California. There's so many people getting plastic surgery for fixing Ozempic face. You may lose weight, but still you're not losing that inflammation. This is the natural way to do it. This is the right way to do it. This is lifelong. You can follow and benefit. So, okay, so what are the 4 key takeaways of today? The 4 key takeaways are that chronic inflammation is the root cause, or one of the 5 root causes that I'm discussing one after the other of driver of lifestyle disorders in the body. We know that the unhealthy lifestyle is the cause of chronic inflammation. We know the third takeaway that Dash lifestyle is the solution. And the fourth takeaway is that the 8 keys to that Dash success that we mentioned is the method. Thank you very much. Don't just rely on healthcare. Also do self-care. And I'm so glad that you're joining me every so often to learn about self-care. When you combine healthcare with self-care, you get wellness. They're both important, and that's why I keep saying my program is Lifestyle Plus. Lifestyle is self-care plus. You may need some medicines also, and there is healthcare. You may need labs, that's healthcare. So healthcare and self-care leads to wellness when you practice Dash the way we discussed. Thank you very much.